Good morning. Good morning. Professor Rajan Varghese, Dr. Arun Kumar, Dr. Anwar Sadat, Dr. Leda, eminent faculty, and dear delegates and my dear students. Whatever has to be told about AI in education has already been told by my eminent panelist, Dr. Rajan Varghese. So I will tell about AI, how it is affecting me, a medical doctor, a radiologist. What is my business? My business is a patient comes to you with some fever, some respiratory problem, and I ask for a chest X-ray. And this gentleman will come to me with an X-ray. And after seeing the X-ray, after hearing his story, and after examining him, I will say that you have tuberculosis, you have malignancy, you have pneumonia. That's what I have been doing. How do I do that? Because I learned, I have seen thousands of such images, and my brain has created a pattern in my mind, and my cognitive sense makes me to give a diagnosis. This is the natural intelligence of a professional. Now, can you transfer this to a machine? Can you make the machine learn all these things and behave like a human being, a cognitive way? That's what artificial intelligence, and nothing more, nothing less. So, we make the machine learn thousands of images, but I can learn only 1,000, maybe 2,000, 10,000. Machine can learn 1 million images. It never gets tired. My eyes will get tired and I will be exhausted. So the machine can learn millions and millions of images from the whole world, and that will be fed into it. And the diagnosis, of course, we have to tell them. We have to tell them what is this, all these images, what is it, you have to tell them. And that also it will be kept in the memory. And then through some permutation combination, it will reach a. So we had a international conference at Chicago of the radiology, the largest conference in the world of radiology. 60,000 people participate in that conference. And I was the national president of Radiology Association, and I went there. Do you know what was the theme of the conference? Will AI make radiologists unemployed? A radiology conference. That was the theme. And all people, all great radiologists of the world were discussing. And we reached a conclusion that it will make us, our job, more attractive, but we have to adopt. We have to adopt for it. So, if you see an image and you give it to the machine. Now, many hospitals in India are using it. So, you go to a hospital, your X-ray will be taken, it goes to the machine, and machine will come out with the X-ray film and the diagnosis. That is happening. It's happening. ECG now almost always it comes with the diagnosis. The cardiologist get the ECG and the diagnosis. Of course, he will have something more than the machine. Machine may not know everything. So what we decided is that they will make a diagnosis, then I can go to the treatment which AI has not started yet. So if I see a mass, then I can put a needle into it. I can and then take some cells and then give it to the pathologist. Now pathology also AI has come. The pathology slide is given. Then the AI machine will say that the cells I have given is this malignancy or this normal. This is how it has affected medical science in a huge way. Now, Are we using AI? In fact, all of us are using AI. All of you are having mobile phones, smartphones. It is why it is called smart. So it has got a lot of AI features. In January 30 of 2020, the first COVID case in India came to Thrissur, just close to the Kerala University of Health Sciences in the Thrissur Medical College. Then within few weeks or month, within a 1 or 2 months, entire country was locked down. We remember. Now actually you cannot go from your house to other house because somebody has put a ribbon around it. You don't remember such things. But then all the education institutions were closed. But we continued education. How did we continue education? We continued our education online. Most of the teachers did not know what to do. Many students knew how it can be done. And everybody got mobile. And there were students who did not have a range, so they climbed on the top of the tree to get mobile range. So those stories you must have heard. But the point is that we use technology. This is artificial intelligence, and we continued education. In Kerala University of Health Sciences, we can proudly say that after 1 or 2 weeks, entire education was on the rail, and we conducted the examinations. So everything was conducted. So when there is an opportunity, we will definitely use it. The opportunity has to come. Now, I remember when I was in the Kerala University of Health Sciences at the governing council, one of the members said he wants to conduct the governing council meeting online because he is abroad, he cannot come very often. And we thought he is joking. How can you conduct a very important meeting online? Today, it is very difficult to conduct a meeting physically because all of us are comfortable online meeting. That again, we are using technology. Today itself, I have got 2-3 meetings, talking with UGC, talking with a American group online. You don't have to travel. So we are all using this technology in an amazing way, and we don't realize that it has become part of life. Now, the word artificial intelligence, again, it has to be upgraded. It is no more artificial. It is actually augmenting your intelligence. So I will rather term it as not artificial intelligence, but augmenting intelligence. It basically augments your intelligence. Nirmita buddhi alla idu, vardhita buddhiyanu. So whatever you are having, you can add on it. And this is a very exciting time in the human history. We have gone through the Industrial Revolution 1, 2, 3, 4. And it is said that in 2025, we will move from Industrial Revolution 4 to Industrial Revolution 5. And Industrial Revolution 5, artificial intelligence, which become augmentative intelligence, that is what going to happen. And there will be a human machine interface, so that the machines will become more humanized, and your specific brain can be augmented by putting a chip into your brain. Now so you don't have to remember entire Encyclopedia Britannica. You put a chip into your brain, and that chip will contain Encyclopedia Britannica. So just think about the possibilities. Think about the amazing. Now in medical science, surgery, robotic surgery has come. It is available in Kerala. In big hospitals in Kerala has got robotic surgery. And if you find that this surgery is very difficult, you need a very expert surgeon, and that surgeon is available only in America. He can sit there in the console. A surgeon in America can conduct surgery in Trivandrum Medical College today. Technique is available. That's again artificial intelligence. So all these things are made possible. So whether we will introduce it in curriculum or not, it has already become part of curriculum. If we educators are not interested in putting in the curriculum, students will leave away from us and learn itself. So there is no question. So actually students are moving in the front and teachers are running behind. This is the real picture. Students are running fast and entire knowledge in the whole world is in your mobile phone. So you get everything. And the teachers who think that they have made a great class, and the student will know that a lot of things are wrong. It's already there. And earlier days, a teacher will make a note and that he will use for 5-10 years. Same class, everything. It is absolutely outdated. The teacher itself is updated. Teaching itself is updated. So the very question of you are insisting attendance for the students, attend what? To attend to hear the rubbish. So this very attendance has become a question in many universities, top class universities in the world. If there is a good attendance, teacher is good. That's all. Because every knowledge is on your fingertip. So in such a beautiful time, Kerala definitely will advance. Because in computers, in softwares, India is on the top of the world. You take the list of any companies in the world. On the top there is an Indian. And there are a lot of Malayalis also. So many people, I think students are here. We may be hearing your name in the coming years. So it's a very exciting time and I'm so happy to be here with you in this very exciting time. Thank you.